Hi, this is Dr. Jenny Yoon again. Welcome to our show. Today we're going to discuss different techniques that are used to preserve fertility in young women who are diagnosed with breast cancer. As we discussed last week, there are options in preserving fertility for these young breast cancer patients. The feasibility, safety, and suitability of different types of fertility preservation options depend on patient's age, the type of breast cancer she has, the type of treatment she has to undergo, and whether or not the patient has a significant other at the time of diagnosis. Other factors that are important in preserving fertility also include the cost of the procedure, because a lot of these procedures are not reimbursed by insurance companies, and also the availability of the procedure and success rate of these procedures. Therefore, you need to talk to your doctor about which of these methods suit you the best. And the fertility preservation, as you know, is highly personal, so it needs to be individualized to ensure best results. One of the fertility preserving techniques is called embryo freezing. With this method, they harvest your eggs and is fertilized in vitro, meaning the egg and the sperm are combined in a laboratory dish and allowed to fertilize. This requires a partner or donor sperm, and the embryo that is fertilized then is frozen for future use. In order to allow harvesting of most number of eggs that are viable, the patient usually has to be on a hormone treatment to stimulate maximum egg production so they can get multiple eggs instead of just getting one egg, which happens with menstrual cycle. These eggs are then collected using a needle that's guided into the ovaries and usually guided by ultrasound or laparoscopy. Embryo freezing is one of the most successful techniques available and safer for patients who have hormone-sensitive breast cancers that are usually called ER positive and PR positive. The egg or oocyte freezing is another technique that involves collection of mature eggs and freezing them without actually fertilizing them, which was the embryo freezing technique we just discussed. This is good for women who do not have a partner or do not wish to use a donor sperm at the time of the oocyte freezing. The success rate of this procedure is kind of variable. Another technique is called ovarian tissue freezing, which is a technique that involves actually removing portions of the ovarian tissue and kind of chopping them into small pieces and freezing them for later. This tissue is then used later when the person is ready and transplant back into the patient's body for it to start producing eggs for her when she's ready. This is kind of an experimental method, and the success rate of it kind of varies. The other technique that's still kind of experimental is called gonadotropin releasing hormone, or GnRH analog treatment. It involves treatment of the woman with GnRH hormone analog during chemotherapy, which kind of tricks her body into thinking that it sort of is existing before puberty, and this reduces damage to her reproductive organs and preserves fertility better than if she was, actually 30 years old or 40 years old at the time of diagnosis. This has shown to be promising, but data is kind of limited. As you can see, there are several methods that we can use to preserve a person's fertility. It's important that you talk to a specialist before you actually start your breast cancer treatment to see which one of these is best suited for you and which one will work the best for you. This is Dr. Jenny Yoon. See you next time when we discuss the effects of breast cancer and whether it's safe for you to get pregnant after the treatment. See you next time.